Acetaminophen, commonly known by the brand name Tylenol, is one of the most widely used over-the-counter (OTC) medications in the world. It's used to reduce fever and relieve mild to moderate pain in both adults and children. But using acetaminophen correctly is essential to avoid potentially serious health risks, especially liver damage. How acetaminophen works. Acetaminophen is classified as an analgesic, pain reliever, and antipyretic, fever reducer. While its exact mechanism isn't fully understood, research suggests that it works by inhibiting prostaglandin synthesis in the brain. These are chemicals involved in pain and temperature regulation. Unlike NSAIDs, non-steroidal anti-inflammatory drugs, acetaminophen does not reduce inflammation, which is why it's often preferred for individuals who cannot tolerate NSAIDs due to stomach or kidney issues. Correct dosage and usage. Always follow your healthcare provider's instructions or the dosage listed on the product label. Acetaminophen comes in multiple strengths and forms: tablets, chewables, liquids, and powders. Using the wrong dose or mixing it with other acetaminophen-containing products can lead to overdose. Standard adult dosage. Maximum single dose: 1,000 mg. Maximum daily dose: 4,000 mg. Take no more than every 4 to 6 hours. For children, dosing is based on weight and age, so it's critical to use the appropriate product and measuring tool. Use only the provided dosing cup, oral syringe or spoon, not household utensils. Important safety guidelines. 1. Avoid alcohol. Combining acetaminophen with alcohol significantly increases the risk of liver toxicity. According to the FDA and research published in the Journal of Clinical Pharmacology, even moderate alcohol use can elevate liver enzyme levels when taken with acetaminophen. 2. Don't take multiple acetaminophen products. Many OTC and prescription medications, like cold, flu, or pain relievers, already contain acetaminophen. Taking more than one of these products at once can unintentionally lead to overdose. 3. Interactions with other medications. Acetaminophen can interact with drugs like warfarin, Coumadin, increasing the risk of bleeding. Always inform your healthcare provider or pharmacist about all the medications you're taking. Common and serious side effects. While acetaminophen is generally well tolerated, side effects can include nausea, headache. Serious but rare complications may include liver damage, allergic reactions. Seek medical attention if you experience yellowing of the skin or eyes, dark urine or upper abdominal pain, which could indicate liver problems. When to stop and call a doctor. Stop using acetaminophen and consult a healthcare professional if pain lasts more than 10 days, adults, or 5 days, children. Fever lasts more than 3 days. New symptoms appear. There is redness or swelling. These may be signs of a more serious condition requiring medical attention. Storage and overdose response. Store all acetaminophen products out of reach of children. Accidental ingestion can be life-threatening. If an overdose is suspected, immediate action is critical. Call your local emergency services or the Poison Control Center at 1-800-222-1222 in the U.S. Correct dosage for adults. 1. Oral dosage, immediate release. 325 mg to 1,000 mg by mouth every 4 to 6 hours. Minimum interval, every 4 hours. Maximum single dose: 1,000 mg. Maximum daily dose: 4,000 mg. 2. Oral dosage, extended release. 1,300 mg every 8 hours. Maximum daily dose: 3,900 mg. 3. Rectal dosage, 650 mg every 4 to 6 hours. Maximum daily dose: 3,900 mg. 4. 4 dosage, parenteral. For adults weighing greater than or equal to 50 kg. 1,000 mg 4 every 6 hours or 650 mg 4 every 4 hours. Minimum interval: 4 hours. Maximum daily dose: 4,000 mg. For adults weighing less than 50 kilograms, 15 milligrams per kilogram 4 every 6 hours or 12.5 milligrams per kilogram 4 every 4 hours. Maximum dose: 75 milligrams per kilogram per day. For use, always verify both the dosage in mg and the infusion volume in ml. Make sure the infusion pump is correctly programmed. Important warnings: the maximum daily dose includes all forms of acetaminophen, oral, rectal, and any combination products like cold or flu medications. Some manufacturers now limit the daily maximum to 3,000 milligrams to reduce the risk of accidental overdose. Avoiding liver damage: never exceed 4,000 milligrams per 24 hours from all sources. Avoid alcohol while using acetaminophen. Both are metabolized by the liver and can lead to serious liver injury. Watch for duplicate ingredients in cold, flu, and pain medications. Many contain hidden acetaminophen. When to stop and seek help: discontinue use and consult a healthcare provider if pain lasts more than 10 days adults, fever lasts more than 3 days, new symptoms develop, or existing symptoms worsen. You notice yellowing of the skin or eyes, dark urine or abdominal pain, signs of possible liver damage. Did you know? Acetaminophen is often used alongside opioid medications for managing moderate to severe pain, especially post-surgery. In such cases, your provider will guide the dose to avoid overdose. Usual pediatric dosage: by age and route. For parenteral dosing, pain or fever, neonates up to 28 days, 12.5 milligrams per kilogram 4 every 6 hours. Max: 50 milligrams per kilogram per day. Infants 29 days, 2 years, 15 milligrams per kilogram 4 every 6 hours. Max: 60 milligrams per kilogram per day. Children 2 to 12 years, 12.5 milligrams per kilogram 4 every 4 hours or 15 milligrams per kilogram 4 every 6 hours. Max single dose: 15 milligrams per kilogram, not more than 750 milligrams. Max daily: 75 milligrams per kilogram per day, not more than 3,750 milligrams. Adolescents, 13 plus. If less than 50 kilograms, same as above, 12.5 to 15 mg/kg 4 every 4 to 6 hours. Max single dose: 750 milligrams. Max daily: 75 milligrams per kilogram, not to exceed 3,750 milligrams. If greater than or equal to 50 kilograms, 650 milligrams 4 every 4 hours or 1,000 milligrams 4 every 6 hours. Max daily: 4,000 milligrams. Oral dosing, pain or fever. General rule: 10 to 15 mg/kg orally every 4 to 6 hours, not to exceed 5 doses per 24 hours. Dosing by weight, age estimates in parentheses. Weight kg. Dose range: 2.7 to 5.3 kilograms. 40 milligrams. 0 to 3 months. 5.4 to 8.1 kilograms. 80 milligrams. 4 to 11 months. 8.2 to 10.8 kilograms. 120 milligrams. 12 to 23 months. 10.9 to 16.3 kilograms. 160 milligrams. 2 to 3 years. 16.4 to 21.7 kilograms. 240 milligrams. 4 to 5 years. 21.8 to 27.2 kilograms. 320 milligrams. 6 to 8 years. 27.3 to 32.6 kilograms. 400 milligrams. 9 to 10 years. 32.7 to 43.2 kilograms. 480 milligrams. 11 to 12 years. Children 12 plus years. 325 milligrams to 1 g every 4 to 6 hours. Max daily dose: 4,000 milligrams. Extended release: 1,300 milligrams every 8 hours. Max 3,900 milligrams per day. Rectal dosing, fever. Dose. Frequency: 6 to 11 months. 80 milligrams. Every 6 hours, max 4 doses. 12 to 36 months. 80 milligrams. Every 4 to 6 hours, max 5 doses. 3 to 6 years. 120 milligrams. Every 4 to 6 hours, max 5 doses. 6 to 12 years. 325 milligrams. Every 4 to 6 hours, max 5 doses. 12 plus years. 650 milligrams. Every 4 to 6 hours, max 6 doses. Quick facts. Acetaminophen is safe when used properly. Never exceed the maximum daily dose, no matter the form. For oral or rectal. For long-term or high-dose use, talk to your pediatrician first. Used properly, acetaminophen is one of the most trusted medicines for children. Just remember, right dose, right time, right weight. Like, share, and subscribe for more expert-backed guides on child health and medicine.